my name is Adrit, and today I'll be talking about improving the explainability of medical AI. So a bit about me. I'm an incoming junior at Palo Alto High School. I'm also a research intern at Stanford working on the applications of AI to healthcare. I'm mainly interested in medical image analysis, developing AI-based apps for clinical deployment, as well as researching explainability of AI for healthcare. I'm an associate member at the Sigma Xi and the founder of Aerotech Inc., where I conduct app development courses for kids. In my free time, I love to travel, fence, and develop apps. So access to healthcare is a significant global health issue affecting people across the world. According to the WHO, approximately half of the world's population lacks access to essential health services, and major factors which affect the accessibility of healthcare around the world include very low physician to population ratios, a lack of healthcare infrastructure and resources, as well as economic barriers both on the patient and clinic side. Artificial intelligence, or AI, is a technology which has the potential to significantly impact healthcare at a global scale. And in the past decade, there have been various advancements in the general field of AI, as well as the applications of AI to healthcare, which are numerous. So when deployed in a correct manner, AI can really increase the accessibility of healthcare at a global scale. In the past few years, the amount of AI-based medical devices approved or cleared by the FDA has really skyrocketed, and this really speaks to how AI models are getting more and more accurate at analyzing medical data. And so one specific area where AI is really making an impact in healthcare is medical image analysis. Deep learning algorithms are being trained to detect various diseases in all types of medical imaging modalities, and these systems really have the potential to increase the efficiency at which patients are screened while reducing the current high burden on clinicians and radiologists. Additionally, these algorithms can also increase the accuracy of diagnoses by reducing errors. So the next step after these AI models are developed and validated is enabling a widespread deployment in a way that these models can really make a global impact to healthcare. And when deploying these AI models with this goal, it is important to prioritize accessibility. It is also important to make these models affordable, especially for low-resource clinics where they may not have the computing resources to integrate AI models into their current clinical workflow. Another really important consideration when deploying AI models is making them explainable. So AI is often referred to as a black box, but to really make an impact, clinicians should be able to really understand why the AI model is outputting certain predictions to enable robust and reliable clinical decision-making. So in the general field of computer vision, explainable AI, or XAI, has been a very important field of research. Researchers have been developing tools that uncovered the reasoning behind models' predictions, and a notable XAI technique being used in the field of medical image analysis is GradCam, which is able to provide a visual heat map showing the regions of a given image which most influence a model's prediction. And these Salency heat maps are currently being used in various computer-aided diagnosis products. Medical image classification algorithms are often evaluated solely based on quantitative metrics, which do not always represent the true performance of these algorithms from a clinical perspective. For example, in a study published in Nature Machine Intelligence, researchers found out that an AI model trained for radiographic COVID-19 detection was actually providing predictions based on irrelevant textual markers on the X-rays rather than the actual lung region. Another study published in Nature Machine Intelligence benchmarked various Salency heat map methods on a chest radiograph dataset and concluded that regardless of quantitative performance, Salency maps were consistently worse than expert radiologists in terms of focusing on clinically relevant visual features. When a clinician interprets a medical image, they're able to apply cognitive visual attention, which allows them to disregard clinically irrelevant regions of the image and make a diagnosis solely based on regions of clinical importance. However, AI algorithms tend to evaluate features more generally as they lack the subconscious clinical knowledge which the trained clinicians have. And this can be very problematic for computer-aided diagnoses, and clinically irrelevant heat maps can reduce the clinical confidence in AI tools. Selfattention was a technique first introduced in the field of natural language processing and later applied to the general field of computer vision. And the main goal of self-attention in computer vision is to replicate the cognitive process of visual attention by enabling computer vision models to increase their focus towards more relevant context and images. And these self-attention mechanisms have shown to increase the performance of models significantly on various general benchmarks. So these are examples of three notable self-attention mechanisms for computer vision: the convolutional block attention module, or CBAM, the global context block, or GC, and the squeeze and excitation block, or SE. In our study, what we aimed to do was validate the efficacy of these self-attention mechanisms on various medical image modalities to see if they increase performance, but more importantly, the visual explainability of models. Based on a traditional quantitative validation across 4 different medical image datasets, these attention mechanisms consistently increase the performance of the models based on the AU-ROC when compared to the baseline. However, as shown in other studies, an increase in quantitative performance does not necessarily mean that the Salency heat maps are more clinically relevant. As shown are samples of Salency heat maps generated using GradCam for the baseline ResNet 18 convolutional neural network and the subsequent attention augmented models. And what we can see is a significant change in the heat maps, which generally change from being more distributed to more focused upon the addition of attention mechanisms. Now, to confirm that these attention mechanisms not only increased the quantitative performance of the models, but the visual explainability in terms of attending towards more clinically relevant features, we conducted a user study. We showed practicing clinicians heat map images of the baseline model and the attention augmented models and asked them to select the model which they felt focused on the most clinically relevant regions of the image. And in all but one of the samples, the clinicians chose an attention augmented model. This was also confirmed through clinical descriptions provided by the clinicians stating why the attention augmented models provided more clinically relevant heat maps. Self-attention is just one of the many methods which provides a step towards replicating the very important process of cognitive visual attention, and is really important to replicate this within AI models as it can enable models to focus on more clinically relevant regions. As shown in our study, this not only leads to increase in quantitative performance, but enhances the explainability of models as they are now looking at images with a greater focus towards more clinically relevant information. So by improving the explainability of algorithms, we can really increase the clinical confidence in AI models, which can lead to a wider adoption of computer-aided diagnostic tools at the point of care. I would like to thank the Global Health Leaders Conference team for this opportunity, my mentor, Dr. Lamy, and all of the collaborators on the study, and I would also like to thank my family for all of their support. Thank you for listening, and you can reach out to me by email if you have any questions. Thank you.